tell us what you don't like about yourself, Mrs. Pierce.
Well, I guess the fact that I'm not perfect.
Well, who is?
Barbie.
What?
There are two things that really strike me about the beginning few seconds of this show. First of all, asking somebody what you don't like about yourself. Why not ask them, what do you hate about yourself? Or why do you hate yourself so much that you're coming in to see me? When I see new patients, I usually ask an open-ended question like, what would you like to talk about today? Or what can I help you with? And the second thing that's very bothersome about this interaction is this whole perfect and Barbie thing. Yes, there are some patients who actually think that they can see a plastic surgeon to make them perfect. But to ask to look like Barbie?
Barbie and Ken are the synthetic embodiment of the ideal postmodern couple.
Not to mention they've been together for 50 years, never aging, just changing outfits.
Of course, he doesn't have a penis and she doesn't have anything.
Because they've made the ultimate monogamous commitment. A sex-free relationship.
Why exactly are you here?
Show them Skip. Skip had his nipples removed. One less erogenous zone for him to think about. And now we'd like you to remove mine.
I've made nipples shorter. I have made them bigger. I have made them lifted. But I have never had a patient ever ask me to have her nipples removed. What is going on here?
We've both been obsessed with Barbie and Ken since we were little kids, and we just want to take one more step to becoming more like them. That's all.
I get patients who come to see me and they ask for J-Lo's butt, or they ask for Halle Berry's breasts. But I have never had somebody come in and ask me to look like a plastic doll. You got to start wondering in this situation about psychiatric problems like body dysmorphia. These are not patients that you operate on. These are patients that you send to a psychiatrist.
Oh, that tickles.
Sorry.
It's okay. They've always been sensitive.
Well, the dermal nerve networks and concentrations of tissue around the ducts, along with minute hair follicles in the areola itself, all contribute to the area's hypersensitivity, which is a fancy way of saying your nipples, our nipples, were designed for pleasure.
The doctor is marking his patient apparently for surgery, yet does it seem a bit creepy? Like there's kind of this sexual weird vibe going on here? Is this making you as uncomfortable as it's making me? Because it's definitely making me uncomfortable.
You two seem very happy together.
Of course. He's my fantasy come true. Wouldn't you be?
Huh?
Okay, so the creep factor continues to rise in this show. There's definitely this weird vibe going on between the two of them. The first thing as a doctor, especially as a surgeon, you have to know, and you're taught, is that you don't have sexual relationships with your patients. It's considered unethical, and you can get into big trouble if you do that.
Are you okay? Fine. I hope he's happy. She's a perfect doll now.
Two weird things here. So they have this window where apparently the family can watch as he operates, and the boyfriend is watching the girlfriend have surgery. I've never ever seen that before. And the second thing is that the surgeon is upset. He's obviously did not necessarily want to do this operation. Well, you're not forced to operate on somebody. So why did he do the surgery if it pisses him off to do it? This is really strange.
Just like Barbie now.
Want to have a seat on the bed? I'll check those stitches.
You did such great work. I can't wait for Skip to see them. He's gonna love them.
Yeah.
Creepiness goes up. We're at a 7 now. Where's the chaperone? He is examining her. She's topless with, granted, no nipples in this bizarre, strange situation, yet there's nobody there with them. And what looks like a hotel, maybe converted to a hospital room? Creeporama!
I had a moment where I imagined what it would be like to give up sex. To have that kind of relationship where you don't touch each other, and
It what?
it isn't natural. You're not just denying the act of sex, you're denying intimacy, passion.
Skip and I are intimate. We just choose not to be physical about it.
What is going on here? This is so inappropriate. This is really, really weird and creepy, and I tell you, if they start hooking up, I am seriously going to turn the TV off and I am walking out this door because this is really, really wrong. Wrong.
How can you choose to give up that feeling you get when your skin makes contact with someone else's and that charge just runs through your whole body like every nerve inside you just caught fire? I mean, the way you described it, hands grabbing, smacking, that's about passion, fire. And you're not trying to catch your breath, you're trying to inhale someone else's.
Seriously? This is a doctor and his patient? No nipples? By themselves? Talking about this? Seriously?
And it's complicated, it's messy. And I say every minute of pleasure is worth the pain it might bring later, because nothing on this earth can make two people feel that good.
That's it. This is the dumbest show I've ever seen. I give this a 1 out of 10 on the realistic scale. I've never ever seen anything this stupid happen in real life. Oh my God. How did this show last for so many seasons? For those of you who are watching this and you think that this is real life plastic surgery and plastic surgeons do this, they do not. And God forbid, if you do hear of a plastic surgeon acting this way, please report that doctor to the state medical board and let me know about it, because this is insane. All right, now that I have gotten that off my chest, you may want to watch more actual real plastic surgery stuff. Check out this playlist that I made where I react to recent episodes of Botched. They're fun and they will shock you.